You should know about Erb's palsy is that it is an injury that occurs oftentimes in newborns at the time of delivery. And what happens is that when a newborn is coming through the birth canal, at the last moment when the head peaks, unfortunately some children, their shoulder will get stuck under the pubis symphysis, which is the part of the pelvis, a woman's pelvis. And when that shoulder gets stuck, the obstetrician is faced with essentially an obstetrical emergency. They have to get that baby out of the birth canal within a relatively short period of time, because the time that shoulder is stuck, the umbilical cord is also compressed, so the baby is not getting oxygen and blood. What happens then is the doctor has to get this baby out. So they will put the woman, the mother, through a series of maneuvers to try to release that shoulder, it's the anterior shoulder, and get the baby delivered. In doing so, if the doctor isn't careful, they can put excessive traction on the baby's head, trying to get the baby out from under the pubis. And when they do that, they can cause this angle between your head and your shoulder to be extended. And when that happens, you can stretch what's called the brachial plexus, which is a series of nerves, C1 through C6, that innervate your arm and hands and provide the necessary nerves for function and feeling in that part of the body. And if you stretch it too far, you can tear or completely avulse the nerve from the spinal column. And when we say avulse, we mean literally pull that nerve root completely out of the spinal cord. When that happens, the child is ultimately delivered. When the child's ultimately delivered, the pediatrician will note that the child's arm is oftentimes limp, or it will turn in shortly after birth. And that will tell the pediatrician, uh-oh, we have an Erb's palsy. Then they will evaluate the child, and they will make a decision whether or not that Erb's palsy is something that will resolve. Most of them will resolve. It's just a stretching. But the severe ones, oftentimes where doctors have put excessive traction on that head, trying to get that child out, won't resolve. And that baby will be left with permanent disability, will ultimately require multiple surgeries to try to return to function to the best of whatever they can. But they will never have a normal, completely normal, functioning arm. There's the whole realm of, there's the whole spectrum of injury, from mild to very severe. And people can ultimately be very deformed as a result of a severe Erb's palsy. Inevitably, Erb's palsy is almost always due to a widening of that angle between the head and the shoulder during the birthing process. Almost always, that widening is due to traction by the delivering physician in trying to get the child out. It could also happen, I guess, if you used forceps, these big clamps that go around a child's head, and a physician pulls too hard on the head. That could happen. Or a vacuum, they put a vacuum suction cup on the end of a child's head and pull it out. But usually it's an obstetrician's hands on a child's head, and they're pushing down on that head, trying to get that anterior shoulder, the upper shoulder, the shoulder that's pointing up toward the mother's belly button, trying to get that shoulder under the pubic bone. And if a woman has a child with an Erb's palsy, they should have somebody look into it. Oftentimes, it's not due to negligence. But if you have an Erb's palsy, your child has an Erb's palsy, odds are it was related to traction by a physician. One final point is A temporary Erb's palsy, that's a whole different game. That can occur through mild traction. And those almost always resolve on their own. When we're talking about excessive traction, it is usually an avulsion of a nerve. So if a woman has a child and she's told these nerve roots are avulsed in your child and we're going to have to perform surgery to try to restore the function to your child's arm the best that we can, that mother, I would suggest, needs to go talk to an attorney and have somebody look at the care and treatment of that delivery.